perfect. Don't ever have a light on like that, right? It's gonna blind them. Okay, so Bob, today we have you in for a crown prep on that lower left, on that tooth that's bothering you. Right? Right. Okay. So since the last time we saw you, has anything changed in your medical history? Yeah? Okay. Well, what happened? Okay. Blip, 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 blip. Put it in there. Perfect. Nothing to the extent that we're having to alter our anesthetic. Okay. But if he had any type of, bypass surgery, a hip joint, any of those things, what would we do?
Ask if they're taking any medication, like if they're prescribed anything specific.
Yep, asking if they have to have a pre-med, especially if they've had an artificial joint replacement of anything. What about if they had a triple bypass surgery? I mean, obviously that's a huge heart. Yep, so we'd have to double check our anesthesia, right? But he just ended up having some shoulder stuff that required no surgery, okay? And he's on a new men's vitamin, okay? We just uploaded our stuff in our Eagle Soft. Okay, and then I'm gonna go ahead and put my bib on him. Where did my bib go? Over there. Yep. Like, all right, get your bib on here. And now, before Doc comes in here, I'm going to grab a shade of your tooth just so we can get that crown looking pretty nice for you when you come back in a couple weeks. Okay, thank you. Also, remember kind of how it goes when we'll have Doc come in. I'm going to place a little bit of topical to get that area nice and comfortable before he comes in to get you fully numb. It looks like we have, what's the flavor? Bubblegum. Bubblegum good with you? Okay, good. Because if not, I have mint. Those are the two flavors we got. It's no dye. I ordered specifically no dye just because people have allergies. Alrighty, it looks like that looks beautiful. Okay, let's see here, making sure it looks good with that. Yeah. As you see, ladies, we have more than one color of teeth. Okay, so it's going to be kind of a combo of these two. Do you see how that matches just perfectly from light to dark? Okay, so think about that. Okay, when you're doing a crown, there's more than just one solid color. Okay, I'm going to lay this aside, so I'll need that. Okay. Alrighty, go ahead and turn towards me. Maybe. There you go. Perfect. Oops. Go ahead and open mouth. There you go. Close your mouth for a little bit. Perfect. And then we'll wait for Doc to come in, okay? That's how I would do it in real life, okay? I'd let my patients sit up unless they wanted to lean back, okay? They don't need to be laying back all the way because your doctor is 6 foot, 5 foot, right? Even though on our comp says that we adjusted the chair, you don't need to. I'm gonna slide this around because I cannot do anything without it being that way. Okay, and then you retrieve your dentist, right? I'm here. Bob, how you doing? Great. All right. Giraffe sat in this chair. Nice and slow. Nice and slow. How you doing today? You're good? Okay.
You liking that bubble gum?
And then I'll just hire him up. This one. He's like, I love the bubble gum. I would like that in my stocking.
Me too.
You love bubble gum. Bubble gum topical. It's even better. There we go. Thanks. I have little elves over here. All right.
Just in time for Christmas. gonna rip your tongue out.
Hold on. Stop. We're gonna not do this yet. What do you think I'm gonna do?
Oh, I know.
I
I
just
totally
realized
know.
it.
Dang it.
Dang it.
Give her glasses.
Glad we remembered. Cut! Cut. Make a preliminary impression. This is what is gonna make our custom crown for our patient.
Remember I said if you forget first.
So when I asked for I need monophase is what you're using to make your preliminary with your dark blue triple tray, okay? When we take our final impression, we're doing the sky blue tray, and when you see it, it's a little bit bigger versus this one's a little more narrow, okay? Monophase for your prelim.
Sorry, bad
You're
turn to
good.
ask this question.
No, you're
but
good.
Which one is it?
Crown and bridge. Yep. Okay, so before I place my topical, after I got consent, confirmed what we're doing, updated medical history, I'm gonna obtain a preliminary impression. Patient is sitting up, just like when we do our bite registrations, we always have them sitting up. What's the first thing I'm gonna do and ask my patient? Can you bite down? Perfect. Bite down just like that on your back teeth. Perfect. Because if they're not biting correctly, your provisional crown is not going to fit. You're going to have to adjust it so much to get his bite to fit, and then you're probably going to adjust through it and there's going to be a hole. Okay? So, let's proceed. See how I'm loading it? It's a good amount. Back and forth. Okay. Go ahead and open for me. Beautiful. And bite down. Gorgeous. Okay.
She's so nice.
Alright. I'm done with this. I'm taking it out. I'm putting it aside. Now I have my crown and bridge material ready to go when it comes time. Okay? I have my heavy and light body with my final impression here. Perfect. Okay, that's going to take a second. Then we'll place our topical. Then we'll retrieve our dentist. Okay? Sorry about that, ladies. Okay, so we had our original tooth in here first. Do not have your crown prep tooth in here, okay? Somebody have their crown prep tooth for me?
Mine has it, I believe.
Okay.
Pull it off in there.
Okay. And then we're gonna just kind of switcheroo.
No. Oh, did I take it out? Oh, my bad.
I'm gonna just lower him until this sets up. Remember, it will take a little bit longer because there's no human, right? There's no temperature in the mouth. There's no moisture.
Did you have some chili last night?
Yeah.
Okay, you so
Did you guys see how I did my bib? Did you notice how I pulled it a little bit before I put it on, and it made it nice and long and comfortable around the neck? Alright, and then you just monitor this until it's set, right, ladies?
Yes.
Still feels so weird, but it's fine. Go ahead and open, please. Beautiful.
Nice.
Alright, so when you pass this around, we have all margins. Everything is beautiful. There's no weird air bubble with like a smear on it. It's all there. Okay? If there is some type of void or a smear and things are not looking good, what can you do? Retake it. Because that having a void in that impression will cause your temporary to have a void, and then you're going to have to work extra hard to adjust it get it looking good and feeling good for the patient, okay? Alrighty, now we're gonna go ahead and numb our patient. Turn towards me. Doing good. Hit bone. Great. Beautiful. Alright. So then I'm gonna go off, I'm gonna do a check and hygiene. Okay. And then you sit nice and comfortable, right? You kind of chit chat with your patient for a little bit. You can open things if you need to, get everything else fixed up. Maybe your neighbor was borrowing your impression trays, things like that, okay? All right, so now I come back. And now I'm gonna prep the tooth.
Voila. Here's this, Miss Vicky.
But I will do a little, put the tongue back to that patient. Okay, also one thing, ladies, when you have your preliminary, if you need to, you can take a tool, and I like to kind of scrape on my impression, just so I know that's my tooth I'm working on, right? There's all these other teeth in here, and you get all busy and you fill it with this one, and then you go put it in the mouth, and then you're like, where's my temporary? Because it's not in the right tooth. So I just kind of do that in the beginning of my life of being an assistant. I would always mark this just so I know, so I'm not wasting my time, falling behind, putting, yep, I just kind of scratched it.
Wait, though, you can't see it.
Yeah, see how I kind of scratched it, and we'll zoom in. Yep. So that would be something I would do. Because there's going to be times that it might get behind. Maybe the doctor's having a really hard time getting that margin correct, and he's having to go back and forth, or he does the build up and then he just doesn't like it and it takes forever. You need to be able to load this up ready to go and not put it in the wrong tooth, and then you're going to have temporary material all over the place. Okay? So that's just a little thing. All right, so let's go ahead and prep this tooth. Hold on, I gotta get my burr in here.
Which burr are you using?
Diamond.
Diamond for crown cut.
I don't know, I think. And when I do this in real comp, I will kind of adjust the top of your provisional a little bit, but I'm not going to do it right now. Not your provisional, but the prep. Keep drying it off each time I'm done. Start getting into the habit of it. Wish my holder for my handpiece was right here, but it's gonna be like that for a second. Because now I'm gonna get out my mirror and I'm going to look at my margin, making sure everything feels good, and I'm gonna go back in there. Adjust that a little bit more. Like my pretend holder. Isn't that awesome? I'm a dreamer. I'm a dreamer. Okay. Alright, let's check our clearance here. So I'm having my patient bite down and I'm looking at the clearance and the occlusion. I think it looks pretty good, but I think I might adjust that in real life when I do it, just because it does look high, but there is clearance. So we're good. Okay. Alrighty. So now prep is done. I'm going to go start another comp with another patient while Nicole sits down to what next? What do you think we're going to do next?
Make that provisional.
Nope.
Oh,
What's after the prep? Before your
cord.
Your cord. Yep. After the prep, before our impression is our cord.
Oh my goodness. What size are you using?
We're going to use a 00. Actually, no. Let's just do our 2. We're going to do 1 cord this time.
Okay.
Let's do our 2. Okay. I wet my cord because we work with plastic people here. And this is going to be so fun. But as an assistant, you come down and you sit and do this because then I am going to another crown prep to start that. Does that make sense?
Mm-hmm.
Okay. So she's just kind of assisting me right now. And I know we should have done some lubrication, but it's fine. We need Hallie to edit this video so she can put music in it right now because it would be like so perfect.
Like elevator music?
Mm-hmm. When she was working on her video, I would hear, I'm like, dang, you got noise and music. I'm like, I love it. I'm like 5 points extra.
Wait, you were talking about her
Her video.
OHI?
Mm-hmm. When she was working on it, I was like, yes.
I know, I'm excited to watch it.
I'm big on things like that, just the little things.
I wish I knew. I just don't know.
How
to do it?
Mine has like a bunch of sounds and videos and words. And
Yeah, I don't know how to do it either.
Turn towards me.
mine's gonna be funny to look at.
I think we should put it up
Mine's
on the
boring.
screen.
They're sitting there for a whole 20 minutes, like, falling asleep.
Oh, it's done, it's done. The credits are coming on. All by Hallie.
Different in real life.
I know. It's so nice in real life. Like in real life, it literally takes like
Does it? It slides
minute.
Right, it slides right in.
Oh,
A
perfect.
minute.
I like to hear that instead of having to sit there and shove it in.
Okay, how long do we set this in here for?
5 to 7 minutes.
Okay,
Or according to manufacturer's instructions.
perfect. Dang, I did pretty good, guys. Much better than the other day. Oh, no, I just pulled it out.
You probably need some more lube.
I
Wet.
probably just need, oh, look, I held my thumb there.
Yeah, it
Okay.
looks still a little damp.
Mm-hmm. You just have to tuck it in there. Oh, look at that. I did it, girls. I did it. It's true. I did it.
It's true.
It's true. Okay, it's not false. Alrighty. Sounds good. That's beautiful. So, Dr. Kate enjoys the cord so much that we're going to leave it in for our impression. Let me tuck this little thing right here. Because that's how I went to dental school at the University of Iowa. Okay? And that's how I was taught. Actually, that's where I would go to dental school.
I
Believe
know,
it or
I
not.
heard it's a great
That's
school.
where Dr. Brett went. So I'm like, yep, I'll go there.
Yeah. Dr. Young went there too.
Okay, so now I'm back. Put on my new PPE. Okay, so let's go ahead and get ready for the impression. So while I'm doing that, I'm going to isolate, and she's going to what?
Prepare the
The final impression.
remove the cord.
I'm gonna leave it in.
she's
Yep, I'm the doctor that leaves it in. So what are you
Okay.
gonna hand me first,
she's gonna
Miss
give you the
Nicole?
light body
Yep,
while she
Perfect.
prepares the heavy body.
perfect. See how she handed it to me?
Ready to
Her hand was here,
pew pew.
right?
Yep.
We're on the lower.
I didn't even notice. I
Right.
just did it.
Try this again.
They don't pull you over unless you're going like 10 over, really. Honestly.
It depends on it depends on the guy.
Well, like I'm
on the
talking
cop.
interstate majority. Most Kansas highway patrolmen will only pull you over if you're going 10 over. That's what majority does. Yeah, yesterday
depends
I
on
was
the
driving.
Do you see how much? Do you see how much stuff she's put in her tray?
Yeah.
She's done,
Loaded.
and I pretty much handed it right over to her. Go ahead and open, and go ahead and bite down. Okay. This is when I would set my patient up because
And start a timer.
start a timer. There we go. Patient doesn't want to lay down for 5 minutes, right? Also, what position are we in when we eat?
Sitting.
Yeah, sitting, and so he can get that jaw, and yes, he's biting. Continue holding that. We gotta let that set for 5 minutes. Okay. Alrighty. And then from now, I'm going to go to another crown prep again and do my thing. And before we even, I stepped in it. Oh,
It's on your shoe.
I got bubble gum.
I didn't realize it was on the floor.
What do you need for that?
I don't know.
Something wet.
I might have to get some.
Well, before it dries out.
Alcohol?
Yeah, I tried some alcohol.
It's over there by the cord too.
Thank you.
Where?
That's warm water.
We need like something to get into the crevices.
Like what? Probably gonna do like a micro brush.
Oh, I see it now.
It does look like bubble gum.
It does. Here and take that funky brush.
Oh, can I get it? Here, can you get it? Sorry. No,
Everything is wrong in this video.
it's hilarious. Please don't upload it to YouTube. They're gonna be like, what kind of school is that?
When that's starting.
One that the instructors don't know anything. But it's a perfect teaching moment. Trust issues. Nicole now has trust issues.
I
Hi. Did you find your present?
I found my present. I'm
Yay.
so excited.
I had to stop at the store and get another 12-pack just because I'm like, I'm gonna enjoy it over break.
As you should. What is it?
It's a holiday Coke Zero, holiday vanilla.
Yeah.
Yeah, and I don't like Coke Zero. I'm a Diet Coke girl, but it was good.
So excited. So, you know, like the one time that you come to do office work and then upscale is just not.
Yeah, it's fried. It's dead.
Here I am.
I hope it never returns.
I do too. I hope it's
This is going on TikTok.
You guys don't have to keep doing this.
No, we almost got it. We are. You're about all clean. No,
So, I mean, if you need me to come do a dance or entertain you guys, like, I'm
She's like, I can't really do
totally
much.
free.
Baby girl.
Go ahead, do the tickling, like,
Can you
you
take
can
your
practice.
Yeah.
It's gonna go in the yearbook.
Get in the chair.
Hold on.
Let's go.
Don't say we don't love you.
I know, right? This is awesome. Getting my shoe clean
Oh
today.
my goodness, how many people we? Oh, look at that. That's
better.
another
Kaylin, can you put some back into it?
Heck yes.
Kaylin, this is for your TikTok.
Yep. I usually keep shoes, girl.
That comes out pretty good on
That
that.
did good. I didn't realize that we were stuffing in it. I'm glad I didn't get up and walk through the
I
whole
know.
clinic
I think I
and
got it all.
bubble gum. Sorry. Okay, wait. Let's do some of our Barnhart.
Let's do that on our shoes with a real patient and then put it in the patient.
Yep, exactly. That's exactly what we do.
I thought so. I always thought their choices was kind of funny.
It's because they were used to clean shoes prior to our appointment. All right, so now they should be nice and set. Okay, do not remove it like in 1 minute. Do a good 5 minutes, okay?
Oh, it's still minute 20 left. They set your 5 minutes.
Okay. Well, I'm gonna set
And
them
I
back.
think it's okay.
All right. Oh,
Just a little chilly action.
that was fun. Sorry, ladies. All right, so now we're going into like the third comp provisional coverage. It's a line on your crown and bridge comp, but then it's now gonna go into the fabricate and indirect provisional composite. There you go, that looks beautiful.
What's the cotton for?
Isolation,
It just came out with it.
because I don't want the tongue to get in the way.
Oh, I just
And
didn't
so that's
see
just
what
the isolation.
I didn't even
Okay.
see you put it in there. That's why I was like,
And so you're going to make sure your doctor sees your impression. So it comes out of the mouth. What are you gonna do?
show it. How
You're
I'm
gonna
okay
rinse
it.
it.
You're gonna rinse it, you're gonna spray it, okay? With your Opticide. Make sure that by the time he does come over to look at it, it's nice and dry in that area. And I'm gonna look at it and be like, yeah, it looks good. Booful. Box it up.
Ship it off.
Okay? So now you're gonna do your provisional coverage. Okay, remember I told you we're gonna use our little lube. Micro brush is the best for this. And you're putting it all over the all over the tooth, okay? Interproximal, lingual, buccal, occlusal. And then I just kind of rub it in. Rub it in, rub it in.
It's just locked.
Yes, because I put it on.
Okay. This probably won't stain, but
That would probably be a mess. Anyway,
I'm done with
it
you
would
guys.
still be a
I don't
mess.
have this locked or not.
it's locked and loaded. Okay, so remember we're doing tooth number 19. So it's
scraped it.
1, 2, 3. I scraped it, so I know what I'm doing. Okay. If this was brand new, you bleed it. Just any brand new thing, you bleed it. But the first thing I'm gonna do is I'm gonna do a test blob on my tray. Okay. And then I'm gonna come in here and you're going to just fill it up to the gingival margin, kind of keeping your tip within it, like so. Okay, that much.
Have you filled to the top?
A little down. There you go. There you go. And a little closer. Perfect. Perfect.
Okay, there we go.
I hand show.
And then it fits right back in the mouth the way it should be. All right, and then your patient's gonna bite down.
But
Okay. All right. Why do you think I have a test blob?
that way we know.
Monitor it, okay? So this material will obviously get harder. It sets up like Jello, okay? It's gonna get hard, but it's also going to be sticky. The reason why it's sticky is so it sticks to your gloves because you're gonna be in and out, in and out. It kind of helps a little tactile, okay? So I'm just gonna come over here and kind of touch it. Right now when I touched it, kind of gave me a Dairy Queen peak, okay? It's still setting up, okay? Now it's kind of getting harder. I'm able to touch it a little bit, but it's still, do you see the sticky,
Yeah.
the gloss that's coming off of it? Looks like pretty lip gloss, but it's not.
You should make a shape like that.
A2.
Yeah.
Okay, so it's nice and I'm able to touch it. It's a little harder, but I can still kind of move it and distort it with my finger. Okay, you don't want it to be too soft because then you can distort your crown before it gets set and then it's not going to fit. I'd say that feels pretty good. Beautiful. And it's on my tooth, so I'm going to use my curette, my Barnhart, and I'm just going to softly come around the buccal and the lingual. A little bit of the interproximal. And when I'm doing this, I am not gonna squeeze it to death. Okay, here is my crown.
That looks good.
Isn't that pretty? I did have a little bit of an air bubble here, right here in the front. Do you think I'm going to leave that?
No.
What could I fill it with? What kind of material?
Zoe, I don't know.
No? Flowable.
Composite. flowable.
Composite flowable. So it's really runny. Nope, the runny kind, the
Because
flowable.
this is made of resin.
Okay. I kind of have a little bit of a hole over here where my interproximal is. I'm gonna fill that as well. Okay, so now that I've taken it off, I'm gonna put it back on. Before I do that, I'm going to remove
A2.
any of the extra crown and bridge material because remember, like I said, ladies, this kind of goes everywhere, and on him it will go into the sulcus.
Well, where's your cord?
I took it out.
It came out in the impression, typically. Yep, so when you take your impression, it should come out.
Into the final one.
Checking the tape.
Hey, that tip was on there prior, so it ain't me.
You loosen it.
Trust this, she's
Yeah.
she's ruined, man. She's ruined. Luckily, we're not doing a root canal today and had some sodium hypochloride. She would have been really mad.
Oh gosh, yeah.
You guys know what sodium hypochlorite is?
Chemical.
It's a fancy word for bleach.
You put it into your what? Should have been in the SDS.
Sorry, ladies.
Yeah,
I'm directing over here.
we did put it in our SDS.
Okay, don't look at the light.
So it should have said sodium hypochlorite, right?
Don't look in the light.
Oh no, the air bubble. Oh,
Like
right?
the
The air
SDS
bubble.
should
Yep.
say
Did you just
sodium
need a little bit of
hypochlorite.
material?
Yep.
I didn't. Why did that look so high?
Oh, me too.
I know I just did it too.
Sometimes it's fun.
It's still going. 4, 3, 2, 1. There we go. I held my breath during that.
For what?
Contact.
Yeah, just a little bit. Go ahead and fill it in there. Beautiful.
Oh, that's
Oh my
gooey.
gosh, don't get it. Oh,
It's okay.
it's fine.
I wiped it off.
There you go. Beautiful. Okay. I'm gonna cure it. Okay, good. Gotta do another round, guys. Don't look. Don't
Hold
look.
your breath.
Oh, that's what he was.
I gotta pull
Yesterday too.
Yeah, it is.
What? I got this pole to block it.
Good.
He's like, oh man, you gotta see these videos for
Okay.
He has a video where he does.
All right, now I'm gonna try my crown back in. Making sure everything's good.
Fitting good?
Yeah, it fits beautiful. Oh my gosh, look at us.
Good work, kiddo.
It's thank you. I was saying that to my kids last night. Willie likes to tell Jack, "Good job, bud," and then I'm like, "Good job, kiddo."
I love kiddo.
So she's got to hold the crown down as she's
That
flossing.
looks good.
Thread it through, right?
Nope, not
You
yet.
can pull back up.
When you're
It's so
checking it, you
sticky.
can, but when you cement it on, you want to thread it through with.
That's good. All right.
Wait, is this cemented?
Nope.
No,
No.
we're checking it.
Right.
You got to check
I was
it
like, you
before.
didn't put anything in it.
No, we're just checking
Beautiful.
contacts and then
He
bite.
bit his tongue. He's numb.
Oh.
Yeah, that's
Shoot it.
no. It's gonna be bad.
So hard that it fell off.
Okay, so when I look at it, everything looks good. We have a few blue marks out on the cusps. That's correct. That's how we occlude, okay? If I were to have any marks within the center and your valleys right in here, that's not good. That means it's high, okay? I'm not going to do any adjusting on this because this beautifully came out on the margins, okay? So it's nice and smooth. We filled the air bubble in the front, and so she filled it and kind of wiped it a little bit before I cured it, so it's nice and smooth. Same with the interproximal, everything is good. This little part right here, do not remove. This is your contact,
Down.
right here.
Go down more. To the side. Right.
There you
There you go, right here. This is your contact. Do not remove that, okay? And then same, anything on the other side. Right there, okay? That's your contact. Okay, there we go. All right, so everything looks good. If I were to make it temporary and it's like really overhanging in the buccal or lingual, I'm gonna have to use a finishing burr, okay? I have been making provisionals for a very long time, so I can use a finishing burr with a high speed. But a high speed takes it off very fast, okay? So you're barely touching it. When you guys are working on this today, I'm gonna have you have your handpiece out with a mandrel and sandpaper discs, okay? Because that's the best way to learn how to get that crown.
She's doing the program shadow.
What's your name again?
Nevaeh.
Nevaeh, nice to meet you.
Thank you. She's done at 10:30 and then she'll
are
just be
making a
back in
temporary
the-
crown and a crown cut.
Okay, so everything is good to go now.
Okay.
Alrighty.
Oh, mix it.
Yep, go ahead and mix it. You as an assistant are going to be doing this all the time. Your doctor is gone. Okay, the moment he approves your final impression, you're making your provisional, you're adjusting it. All the adjustments happen outside the mouth. That's why you have to try this in and out, in and out. And then you're going to mix up your own cement, load it in the crown, and then you're going to cement it. Okay? So,
Wait, hold on. That was 1 to 1? No, 1 to 2.
1
1
to
to 1.
2.
1 to 2.
Okay? So this is how you fill up your crown. Okay?
It's like more like
Alright? You're going to place it in here, and then you're going to have your patient bite down on what? A cotton roll, aka a tooth pillow. Okay?
Like your spatula.
So you want luting. Luting is what goes into a crown. You butter it all in there. Okay, that is your temporary cement. If they were really saliva-y in there, what would you do before you put your temporary crown in there?
blow some air.
Yep.
Or you could wipe it with a 2x4.
Yep. Isolate it. Remember, they're numb, so they don't feel that. Okay? And you're going to let this set up. When you're out there on clinical rotations, depending on the office, they may say, start cleaning that up right now. To me, when it's wet, what did you see when we had our material? Every time you wiped it, it made it worse, smeared. Okay? I'm trained to let this set up, so then you're just picking off the little border of the cement that's around the buccal and lingual. You're not making that big of a mess. But it's probably going to take a minute, but these are new. No, it's still really running.
Yeah, it takes forever.
Okay, so we can pause, time out. You're like, I'll edit it. We need elevator music.
Take a 5-second break.
Okay, so while we're waiting for this to set up, what are your post-op instructions going to be?
Well, obviously it's temp and you had to prep the tooth, so they're going to be numb. Don't eat or drink until they're not numb. And then when you aren't numb, you don't want to eat on that side as long, like you can eat on that side, but you don't want to like eat hard sticky stuff.
It's gonna pop it off.
Yep.
You want to leave that.
Tell
you
them,
want to try on the opposite side.
Like
as much
at least 6 to 8 hours to avoid eating on that side, to let that cement to set up, right? What are you going to show them how to take care of?
If you're gonna floss, you're gonna go down and pull through, not up.
Yep. So if this patient had 8 other crowns in their mouth, do you think they know how to take care of it?
Hopefully by that
Yes,
time.
hopefully. Okay. If it's their first crown, I would get out your patient mirror, have them hold it, show them how you put the floss and pull it through. Okay. Just don't tell them, show them. Get that mirror out. Okay. And then let them know that any sensitivity is normal, right? We used a buildup in here, so that's going to help, restructure that tooth. So sensitivity is normal.
And if your bite feels high.
Yep. Also, let them know that once the numbness wears off, if their bite feels high, to give us a call to adjust it. But right now, it looks great. Like there's nothing high. Okay. That's why you do all your adjustments before you cement it, because once it's cemented, you can't do any adjustments now because this is a high-speed state of Kansas. You can't use a high-speed in a patient's mouth. Okay. So that's why everything is out here, adjusting, all that. And this is taking forever to set
What
up.
do I do if my temporary pops off?
What can you tell your patient?
But you can put
Vaseline or
Yep.
and come back and put it in there because you don't want it to start moving.
Heck yeah. And that area
And
is
that is
sensitive.
why we have this. This goes in a lab pan with our, most likely our crown and bridge sheets are like a carbon copy. The original goes to the lab. The other copy stays in our in-house lab. That this will live in their bucket because they may eat an almond and it cracks and break it, and they may have to come back in to remake it. So we don't throw these away. We keep them, okay? Because this is how we make their provisional.
You need
Okay.
to throw it away when you finally cement
Yep.
the permanent one.
So always do let them know if it pops off to your Vaseline, your toothpaste, and call us so we can get it cemented. Because if we don't, you're gonna have shifting, and then that permanent crown is not gonna fit. Those mesial distal contacts are going to be very tight, and you really don't want to have to make so many adjustments on that crown, okay? Because you're removing the strength and integrity of it.
What's
Let's
another
see.
way I can reduce the patient sensitivity post-op that you guys clumped on already earlier? Gluma, the sensitizer. So when would you put that on during this?
Prior to cementing.
Right before you cement it, you would put the desensitizer on and then cement it on, not before you take the impression. Because there's going to be a film on there that's going to mess that impression up.
This is still
Is it still gooey?
just a little bit, but not
Hurting it?
super duper. So what instrument would I be using to remove my glue? My curette. My Barnhart.
Heart. All of that temp deposit.
Only on the other side.
Where's your pier gonna appear?
Okay. That's beautiful. Good job, Bob.
Put a knot in
Did you put a knot?
that? No, I didn't think I did. Felt like one.
Oh yeah, there's a knot in there. Is this the one that's been on the tray?
Yeah, probably.
Because then that's
That's
probably
why.
the knot.
You're gonna floss them before they leave.
And I put my thumb over the
Finger on
crown
top.
because
That's
I
what
don't.
you tell your patient too.
Beautiful. Alrighty,
You're done. Get out of my chair.
you're done. So we would set them up, right? Now we're gonna dismiss them and we're gonna take them to the front to get them back in 2 weeks. Usually it's a 2-week turnaround, okay? So now we're gonna talk about our lab script right here. So we dismissed, we gave our post-op instructions. Now you're gonna come back and you're going to fill this out. Okay, doctor name, first and last, our practice name, address, phone. You guys can make that up, okay? Your patient name is you're typing on. It says patient chart number. You can just make that up. Normally, it would be your patient ID, which is in EagleSoft. So if you want to look up your own personal patient ID, you can put that there. Your male or female of your patient, their date of birth, the prescription date. So it says RX date. That is today. That is the day this was taken and captured. Okay. Due date delivery on. So that would be 2 weeks. So 2 weeks from today is
December 3rd.
I don't have my phone on me to look at my
December
calendar.
3rd.
December 3rd, okay? So, and then it says please circle single units and bracket splint units. So a splinted unit would be what would be a crown and bridge. So we have a bridge. So we have our 2 crowns and a pontic. We have a single unit, so we're gonna circle tooth number 19. Okay? We have a metal PFM, we have zirconial ceramic, we have a full cast, which is our gold. This is where Kate Benson would be following her crowns with, right? I'm collecting them all now. And then there's other, okay? We are going to be doing a PFM. This is on a lower molar tooth. We need good substance when it comes to our chewing and biting. So we're going to do the non-precious PFM, okay? Non-precious. Sound like plan?
So your precious metal will be your high noble, like your gold.
Your
crowns.
gold,
Oh,
okay? And your doctor is going to pretty much fill
They'll tell
this
you.
out. They'll tell you what we're doing. If we had like a, you know, a premolar or a canine, I could see a zirconia or an all ceramic. just because they're more aesthetically pleasing, especially if that is in your smile frame. But any type of posterior molars, PFMs are the way to go, okay? Unless you have a CIRAC in your office, Dr. Herzog, he makes his crown preps and crown deliveries all in one day. So the machine mills it and they are crown, okay? And then you're gonna come over here and you're gonna circle your margin design. And we want a no-show metal 360. We want it flush to that margin. And like I said, your doctor can fill this out and let you know as well. The way we did it is we had our prescription pad in front of our Penta machine with our lab pan with our stuff and our box ready to go, and Dr. Brett would just do what he needed to do on the things that I didn't know. He's the one that does the margins, right? Okay? And then now we have our characterization. So remember how I picked two shades? One was a little lighter to darker, okay? So when I do this, I would go, I'll get a pin here. We'll use this one right here. So this is your gingival margin, this is your inclusal and incisal. So I'm gonna just kind of draw a little line right here, and then this one is, what's the darker?
67 and you have 66.
So the darker will be closer to the gingival, so it'll be a 67, and then this is a 66.
And then tribute.
67,
Tribute is the
66,
name.
and
The shade
then
guide.
tribute,
You gotta write the shade guide that you use because they're all different.
NA, because we don't need a stump shade or
When would you need a stump shade?
there's like nothing in
Veneers or interior. If you're doing all porcelain on the interior, then we get a stump
there.
shade.
Trim to opposing, we want a tight contact, this is occlusal contact. We want light, and then interproximal, we want medium. Okay, and if there is any type of specific instructions, we would write on here. So if this was a veneer case and we're doing the front 6 teeth, we may say we will be emailing photos of shades for reference because we're really wanting this to look good. We've taken pictures outside in natural light. We've taken pictures inside with just the lighting that